This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, I can see the slides now. Perfect. So I'll try to get through this so that we can answer questions. I appreciate everyone's patience. So we're the University of Central Florida PM&R program located in Pensacola. Next slide, please. And in 2021, we started two programs, the Physical Medicine and Rehabilitation program, and then the OBGYN program. Then this past year, we actually added 3 surgery residents, and we are looking forward to getting the internal medicine program started in 2023. Next slide, please. And then UCF, HCA actually has a lot of residency programs. So there's 26 total residencies and 7 fellowships in the North Florida division. Next slide, please. In terms of benefits here, and you guys can get more information if you look up UCF GME trainee benefits, but we get 20 total days of vacation and 10 total days of sick leave. We'd also get insurance policies and a retirement plan. Next slide, please. And then here at West Florida, there's it's a 515 bed hospital attached with the acute inpatient rehab center, which has 58 total beds. And because of this attachment, you'll basically have good flow of care when patients are transferred from the hospital side to the rehab end, where a lot of your PM&R training will be. Additionally, West Florida Hospital is also an advanced primary stroke center, which is a common pathology you will see in inpatient rehab that you will try to help patients out with. Next slide, please. And this is our program director, Dr. Belcher. She is certified in pain management, and this is our associate program director, Dr. Christopher Burton. He is the manager over at the rehabilitation unit, and you work a lot with him on the inpatient rehab side. Next slide, please. And this is Dr. Buchhalter. He is also one of our teaching faculty, and he is board certified in pain medicine and does a lot of our lecture teaching. Next slide, please. Again, Dr. Burton over on the inpatient rehab unit, and then Dr. Slobodian, who does a lot of coverage for spinal cord injury on the rehab unit. He is spinal cord trained over at Stanford University and does a lot of teaching on the rehab unit side. Next slide, please. Again, Dr. Belcher, she mainly works on the outpatient side over at Clearway Pain, where you end up doing a lot of your rotations. Next slide, please. Another site, which is actually just a short walk away from the main hospital, is the Nemours Children's Specialty Care Center. You end up working with orthopedics there. This is Dr. Reynolds and Dr. Wilson. I just got off a rotation with them, and they taught a lot, and they're really easy and great to work with. And then you work on rheumatology side with Dr. Dorian and cardiology with Dr. Arevalo. So you get a lot of pediatric knowledge. Next slide, please. And then I'm actually starting this rotation next. A few of the other PGY3s have done this rotation and have said great things, but you end up doing 3 total rotations over at Emerald Coast for EMGs, which is a big part of your rehab training. Next slide, please. And then Dr. Cahill, you end up doing 2 rotations with him in your PGY 2 year. This is a great rotation where you get a lot of your fundamental neurological skills, which you'll use in the rehab unit for your physical exams. And then this is Dr. Harris. He's actually a new faculty member that we're all very excited about. He is providing a lot of education, and he's over on the consult side, where he does inpatient consults and then also is looking at helping out with pain management on the hospital side. Next slide, please. And so again, these are kind of your rotations here, and I'll go through this relatively quickly, but main things to look at is on inpatient rehab, we have 6 blocks, the PGY 2-year, and then PGY 3-year and PGY 4-year, we have 3 blocks each. This kind of gives you the chance to not only have your inpatient training as a PGY 2, but you get used to having that kind of senior role in your PGY 3 and PGY 4 years. Along with that, I mentioned the 2 blocks of neurology, which is fundamental, and then you end up working with Dr. Kale on that. And you get outpatient MSK with Dr. Belcher, who's our program director, and then a few pediatric rotations along with EMG. In the PGY 3-year, again, we get some pediatric training and musculoskeletal pain medicine with Dr. Belcher and the pain doctors. In addition to that, we also have started, we're looking forward to starting a rotation with sports medicine, which we actually do with the Andrews Institute. If anyone's familiar with Dr. James Andrews, he's a renowned sports medicine physician and orthopedic surgeon who's worked with a lot of athletes. He's actually over in Gulf Breeze, which is real close by. And even we ended up starting some lecture series with him and people who train under him, and are looking forward to that sports medicine rotation. And we are also looking at doing a spine rotation this year for the PGY 3 years. Next slide, please. And finally, again, those 3 more months of inpatient rehab to get used to that senior role, that continuity of inpatient skills. We get 3 blocks of elective, finish out with some EMG, and then still continue with our MSA consults and pain rotations. Next slide, please. And these are the ACGME program requirements. And, I just kind of put this, we kind of put this on here just for your reference, but, this isn't only at this program, but any ACGME accredited program, you will get your fair share of procedures. I will say for the peripheral joint injections, under ultrasound guidance, the PGY 3s who did the MSK rotation last year, we did way more than these minimum requirements. So you get your fair share of training here. Next slide, please. So here's some pictures of the GME space. We have a lot of computers and things set up for the residents to use. Next slide, please. And then we have this actually new skills lab, which we are very excited about. You guys can see off in the distance. Here's some ultrasound machines and some mannequins. So we were actually just practicing with Dr. Harris on SI joint injections and epidural injections through the sim lab using the ultrasound. So we're all excited about using this more. And so this is a unique thing over at our facility. Next slide, please. Again, just more equipment and procedural, skills that you can learn in the room. This is more trauma, so not really the kind of rehab end of things, but we also have the OBGYNs and surgery residents who plan on using the area too. Next slide, please. Again, just more equipment for us to use to help us train in that sim center, which we're all kind of excited about. I know last year we weren't using it as much because it was starting to get set up, but now this year we've got that up and running. Next slide, please. And then in terms of some facts, Pensacola, it's in the Panhandle, has a lot of sunny days. So if you like kind of going to the beach, relaxing, kind of having a lot of things to do, but not being in that kind of crowded big city type of feel, Pensacola could be the spot for you. So I know all the residents here, we've really enjoyed living here. Next slide, please. Again, some things to do, a lot of beaches, so people get very excited about that. We have good food here. A lot of people like going to this Naval Aviation Museum, so a lot to do here and a lot to be excited about. Next slide, please. And in terms of living, that's a common question I remember as a resident. So you can live downtown or close to the hospital. I know out of the PGY 3s, 3 of us chose to live close to the hospital to have a short drive. But Steve, who's also one of our PGY 3s, he ended up deciding to live downtown. and he's still a short 15-minute drive away. So there's a lot of living options. And again, a lot of fun things to do. This is a picture of us last year. We went down to Destin and had a lot of fun, and that was just an hour and 10 minutes away. So you've got beaches that are 10, 20 minutes away. And then if you get bored of, say the things going on in that area, there's a few other beaches to the left and to the right, just about a half an hour or an hour away. So a lot to do here. Next slide, please. Here's a picture of all of us. This was actually last year when the hospital opened, so everyone was really excited to have the new residents. As a prospective applicant, we're all very excited about, the training programs here, and not only teaching here, but always getting things better. So coming here, you would be in an environment where everyone is very excited to help new trainees get the best education. Next slide, please. Again, more pictures. Here's a few of us PGY3s. We were training with Botox with one of the Botox reps. This was mainly for migraine headaches, but again, you'll get your hands-on training skills here as well. And then here's a picture in the middle of a few of the residents with Dr. Belcher, our program director, and one of the other attendings, Dr. Montgomery, who we work with on the pain medicine side. Next slide, please. Again, and then here's some websites for you to get more information about the program. And then again, some of those benefits I mentioned at the beginning. And then if you guys are on Instagram, please feel free to follow us. And I will now take a look at the chat for questions. Oh, and here's some contact information for a great coordinator, Cody. She just saved the day by putting up the PowerPoint slides. So we have the best coordinator here. Anytime we need any help with anything, she is really great about helping out. And then our program director, Dr. Belcher. All right. Any questions? Okay, I see a question from Mohammed. Thanks for your presentation. Does your program support IMGs? Yeah, great question, Mohammed. We had IMGs, apply and get interviews here last year. So we definitely support IMGs. And if you're interested in PM&R and this program, please feel free to apply. Yeah, and we would love to see, you apply. So we definitely support IMGs. Great question. And then I see a question from Alex. Can you tell me a bit about the call schedule and how lectures work? Yep. So call schedule, because we're a new program, we're actually, figuring that out as the years have progressed. Actually, last year as PGY2s, with the first class, we actually did not take call. And now as PGY3s, we did start the call process. What that began with is the PGY3s taking call Monday through Thursday. And then on the weekend, we have a different doctor covering for the weekends. And what the PGY3s are doing currently is covering on the weekend every other weekend. To kind of go a little bit more in depth about that, what you'll try to look at programs is, how much busy work you're doing, right? So as PGY2s, because we weren't put on call right away, a lot of the focus was on education. And then now starting PGY3, they're starting to give us that responsibility of having call. So anytime you look at a program and call, take a look at, how they set that up. And for us, it wasn't started right away. And then now it's slowly building up, which is great. And then as far as how lectures work, we actually, this doesn't happen at all programs, but we actually have our lecture series set up on 2 different days. So instead of doing, 3+ hours of didactics in one day, we end up doing about an hour, hour and a half in the afternoon on Wednesdays and then on Thursdays as well. Hope that answers your question, Alex. No problem.